I've been using SmartSpeed Precise for over 2 years in its early development. There is no application or imaging sequence that we don't use it on, because once you can see what it can produce, you can't unsee it. In comparison to all other deep learning AI reconstruction products that I've been able to investigate, SmartSpeed Precise is the most natural, truer looking outcome in comparison to most, where you can see over-processing and a lack of sub-detail within tissues throughout the body. The Philips platform optimization parameters in the user interface includes advanced TSE, which is rewarded at the other end of the reconstruction pipeline. It has the advantage of increased resolution for the same voxel size in comparison to traditional fast-spin echo, which is taking advantage of in the neural network's upscaling stage, where it has more resolution to work with. We use this technique in virtually every fast-spin echo sequence. Another huge surprise was the result of single-shot imaging. We use this in most abdominal applications, and we're virtually using 50% more compressed sensing with quality that we never thought was possible before with precise recon. This combination also leads to far reduced pulsatile artifacts, especially at 3T. When using AI, this type of artifact can be enhanced otherwise. The whole speed versus quality paradigm is like having your cake and eating it as well. Our approach has always been to increase image quality as well as speed. However, the speed that we're now capable of is now taking us to a new problem, where how do we support this workflow surrounding the productivity levels? Our business is now invested in increased support staff to help the capabilities, which is becoming the new norm. We can now push the scanner harder than we ever have before and include quantitative MRI applications, translational research, things like dynamic functional MSK and other high-end applications in our routine clinical practice in routine scan times. We now have the ability to repeat scans on patients who are moving for better image quality without the usual time penalties, and patients are generally in the scanner for a shorter time, which can be a problem if they're still looking at the show through the ambient inboard TV. It's really improved our bookings. Our complex bookings are now taking far less time, so we're a lot more flexible in the day when we need to be. Above all, we're just so much more prouder of the image quality and the level of service that we can provide our patients and referring doctors. And as for radiologists, we know they're happy with the increased productivity, but they really love reporting from the new level of accuracy, which gives greater diagnostic confidence.